eating or talking when suddenly, they grab their throat, unable to speak, cough, or breathe. This is choking, a life-threatening emergency that requires immediate action. Time is critical, as choking can lead to suffocation within minutes. To assist, first ask the individual, "Are you choking?" If they cannot respond, they are in urgent need of help. Begin by standing behind them and slightly leaning them forward to aid the dislodging of the object. Using the heel of your hand, deliver 5 sharp back blows between the shoulder blades. This technique may help dislodge the obstruction. If the object remains stuck, you must perform abdominal thrusts. With your fist positioned just above the navel, grasp it with your other hand and push inward and upward quickly. This maneuver can create enough pressure to expel the object. Alternate between back blows and abdominal thrusts as necessary, continuing the effort until the object is removed, or the person is able to breathe again. Should the individual lose consciousness, gently lay them down and begin CPR immediately. Check their pulse, and if absent, administer chest compressions and rescue breaths, following the CPR guidelines. Meanwhile, someone should call for emergency help without delay. Remember, choking is a situation that can escalate rapidly. Your swift actions could mean the difference between life and death. Remaining calm and focused is crucial. Every second counts, so be ready to act decisively. Know the signs of choking and review these life-saving techniques regularly. By familiarizing yourself with these steps, you enhance your ability to respond effectively. Proper training in first aid and CPR can further prepare you for emergencies like choking. Never underestimate the importance of learning these skills, they empower you to help others in critical moments. In conclusion, recognize the signs of choking, act quickly, and always be prepared to call for professional medical assistance. Your immediate response can save a life, making a crucial difference in a choking emergency.